Evening, Littleton. Welcome to the February 14th, 2024 Valentine's Board of Health meeting. It is now 7 p.m. and we're beginning our meeting with our first piece of business, which is to have an opportunity for the board members to welcome Jim Duggan, our new town administrator. We're very happy to have you. Thank you for staying in the office a few minutes late and having a chance to meet us and get to know the board a little bit. So, Jim, if you want to start, just a little bit of maybe an intro, kind of your background and stuff, and then if any of the board members have anything, questions.
Yeah, no, that'd be great. Thank you, Mr. Chairman, members of the Littleton Board of Health. I'm very, very honored to have been selected to be the town administrator here in the community. I'm quite familiar with the community, but I've a little bit of background. I have been involved in municipal government for a couple decades, a little more than a couple decades, and but it's something that I have always found very, very rewarding. It wasn't my intention coming out of school, even though I was a political science major in undergrad, but it was something that really being involved in the quality of life in the city of Lowell, where I had my first job. It was very fulfilling, and I was very impressed by the number of different agencies and boards and commissions, such as the Board of Health, the impact that you had on the community, which really, really showed, especially, back with the pandemic. The Board of Health in every community, and Littleton being a front runner on being so attentive to all the needs and the health issues and establishing guidelines and everything was very, very impressive. And I want to say congratulations, outstanding job from, I knew enough out there to be dangerous, so I knew what you were all doing was a lot more than what you were actually, a lot of work behind the scenes. So, but I'm thrilled to be here. I'm happy to support the Board of Health in any way I can. Congratulations on the hire of a new director. I think it's going to be a great thing for the board, because we are growing, and it's really, really smart, really, to although recognizing and appreciating the regionalization with the service, but now actually having someone that we have here full time is a great step. And congratulations, great job on the process. And I'm very, very impressed with the person you selected.
All right. Thank you, Mr. Duggan. Any members of the board have any questions, comments, anything for Mr. Duggan? Mr. Davis.
Mr. Duggan, welcome. Congratulations on getting the job, and we look forward to working with you.
Thank you very, very much, sir. Appreciate it. And if I may, Mr. Chairman, and members of the board, please, Brenda knows exactly how to get in touch with me. And I'm happy to share my cell phone number with all of you. If there's an issue, I'm very accessible. I can, and happy to have a conversation, have a meeting, anything like that, with any issues that you feel you would like support on. And happy to help. I mean, as far as I'm concerned, we're kind of all in this together. So everyone is pointing in the same direction to benefit the community. So I'm happy to be a team member and help in any way.
Thank you so much, Mr. Wason.
Welcome aboard. Great to have you here. It's obviously a big time, as you mentioned, for the Board of Health and our health department, and we're going to be a little more needy than some groups, I would say, over the next 12 months or so. So I appreciate it. I know we had our recruitment rocking and rolling process going when you first came on board. So I think we have a good candidate lined up, and we're looking forward to getting him in the door. I would say, I'm sure at some point, should probably just have a meeting with Dan, myself, you, Ryan, just to kind of go over some history and stuff, just so you know kind of where we're coming from and what page we're on.
Sure.
I'm not sure when our director is potentially going to start. Dan might have that information, so that meeting might be off while it's not super urgent, but love to kind of make sure we're all on the same page, and we appreciate your support. Thank you.
No, absolutely. I look forward to that discussion, and I know one of the things that's going to be important for the Board of Health is, and for actually helping Brenda, is to making sure that with the new facilities person that we are in the process of interviewing for, that we're going to make sure we have the administrative staff for everybody, the support for everyone down there, and be able to make that investment, which is only going to support you being, the Board of Health, the director, and the team being successful all the way around. So it's good stuff happening. Very, very impressive. Very, very impressive for the community. Thank you.
All right. Anyone else? Gino? Hold
Annette.
on.
Go ahead.
I'm sorry. I hope we don't drive you crazy. Be patient, especially with me, because I try to be nice, but my colleague there, they put me right on the destra. Okay, Gino, what do you want to say? I want to say, finally, the club, I call a club, they are very happy to have you. How's that?
Is it now? Do you pronounce it Fratelloni?
Yeah, you have a very good, it's like that. Make believe you say fratello, that means brother. Fratellone, that means big brother.
Fratelloni. Fratelloni.
Fratellone. Gino Fratellone. But
Okay,
Gino calls me Gino anyway. My club calls me Gino.
They do. All right. Well, I appreciate that, Gino. Thank you very much. And trust me, I've got all the patience in the world. So I'm happy to support, and you can ask me anything. And through my years of experience, if I can help, I'm not shy. I'm not a shy. And if I don't know if I have a question, I'm going to be reaching out to all of you for guidance. And I don't know everything, and I'd love to be able to and learn. So I'm really looking forward to it. Thank you, Mr. Fratelloni.
Grazie.
All right. Thank you again for staying late and spending a few minutes with us. We look forward to having a successful relationship, and hopefully a long and successful relationship between you and Littleton and our residents. So we're excited to have you here. We're glad you're here with us. Thank you for taking some time tonight. And as always, anytime you need anything from us, we always do our best to respond
Absolutely.
as quickly as possible.
Well, thank you, and everyone have a super night and be safe.
All right. Thanks, sir.
Okay, bye-bye.
All right. If it's the pleasure of the board or some leeway, I'm going to share a little bit of information about the director process, since our town administrator was very excited about our new director. Just a quick update that we do not officially have a new director at this point. So the last updates were Monday night at the select board meeting. Michelle from Human Resources, our Human Resource Director, presented the formal request. Our town HR process is any new hire brought in at above a step 3 requires, I'm getting grade and step always backwards, so it took me a second to stop and think. Any hire brought in above a step 3 in their grade requires approval of the select board. So that went before the select board on Monday evening. It was unanimously in favor of the grade 6, step 6 for the grade. So that Michelle has made the offer. I've not heard back from Michelle whether it has been accepted yet. So we are final moments / steps to having a new hire, but we are, at this point, it is completely on the candidate's side to yay or nay the offer. So we are feeling very confident. Certainly all the conversations prior to Monday night select board meeting with the candidate, this was in line with what they were requiring. So, and HR and select board obviously agreed. So as soon as we hear, I will share with the rest of the board and we'll be able to make a public announcement. But we are very, very close, but it is not quite official yet. Before we open up our hearing, any questions? Yes, Matt.
Turn the
Wason.
Wayback Machine. It took me a while to start to
Okay.
analyze this, but the PAC suggested a grade 16, and at our meeting in July of last year, at least 3 of the 5 board members suggested we ask for a 17. And then it went to the select board and asked for a 16. Side note, I tried to look at our meetings from July 26th, and Brenda, when you go on the website and look at the July 26th meeting minutes, it points to the July 12th minutes. So I can't actually look at the 26th. So I couldn't remind myself if there had been an update that came back to us. Do you have any recollection of how that went?
Addressing it to me? Or
I believe so, because I believe you were the one that went to the select board, but I can't tell, because I can't tell from their meeting minutes if it was just Michelle or you, but you sent a memo to us. We discussed at our board meeting. And as I said, several of us said, yeah, the PAC said 16, we should ask for 17. And then I missed a communication, and all that was presented to the select board, which Michelle was presenting from her perspective, the HR director, she supported the PAC and said grade 16, and they said, okay.
it was so long ago now, I'll be honest.
I know. And like I said, it didn't even, in my head, it's been 17 this whole time. And it wasn't until I was talking to Ryan about budget stuff that it was like, wait, 60, that doesn't feel right. But I was trying to dig in and figure this out. Obviously, this could be like the horses left the barn a long time ago. But
I mean, at this point, it has. I mean, the position has been posted, offered, and step and grade have been approved by the select board for the offer. So I think we're agreed. We are where we are.
I think, I mean, I'm not trying to stop the process now or anything, or make a change right now or anything like that. But moving towards FY25, I think we should keep it on our radar and potentially ask for the position to be regraded if that's what we actually, as this board, wanted to ask for, potentially to change that. And part of it is, right, you have to ask for approval from the select board to hire above that step 3. And so I think it might be different if the grade was different. I think that's the, as I looked at that. So if nobody recalls, that's fine. I think we should just I emailed Michelle and see if she has any recollection, but I think we should revisit it at some point in the next year, frankly, to see if that should frankly be adjusted the way that this board seemed to want to go at the time.
Okay. I do have a hand in the audience. I'm not sure if it is regarding the informational piece that we just shared. I'm going to.
Hey, good evening. Ted Doucette, 152 Whitcomb Avenue, and I'm sorry I'm a little late to the party here. I should put my camera on, so that's not up there. But anyway, are you talking about a health agent that you made an offer to, and are you able to disclose that name, or is that confidential? I'm assuming it sounds confidential by the way you've been speaking.
I don't believe it is confidential. It was announced during the Monday night select board meeting that we have made an offer. It just hasn't been accepted. I mean, it's not confidential. I was trying to, again, provide some discretion in case a person chooses not to pursue the position further or changes their mind, just to allow them. But the name is out there. So it is Francis Daigle, who is currently the Leicester Regional Health Director.
Okay, so this was health director or health agent?
Health Director.
Okay, cool.
It'll
All
be
right, thanks so much.
a working director position. You're welcome.
Cool.
Sorry about that. Too many buttons all at once. So I apologize. We're a few minutes late for our 7:10 hearing for 18 Middlesex Street. It is a continuation for a local Title V upgrade approval, groundwater reduction for leaching area and variance requests. And I believe we have Chris Stoddard listed as speaking on this matter. Chris Stoddard, if you're okay, I'm going to promote you to panelist. Never mind.
Oh, it's a little dark, but can you hear me, folks?
We can, sir. Welcome to the Board of Health meeting.
Thank you. Okay, so if you don't mind, can I share my screen? We can
You should be able to. Yep.
Perfect. Okay, so I know based on the last hearing we had a few weeks ago, there was some ideas kicked around. Could the board see the system put in the front yard or the system raised? We physically, mathematically, I can't fit it in the front yard. I'd have to ask for another half a dozen variances. And speaking with the property owner, he's decided to put the secondary treatment unit in. So what we're proposing is it's going to go in the same location as the existing tank was. It's going to be a jet system, jet model J500. We did wrap the liner around the house side of the tank per the board's request. So I think we can, well, hopefully, we should then now meet your local regulation to have the using the secondary treatment along with the 2-foot reduction in groundwater within 100 foot of the BVW or the intermittent stream. I'm hoping that satisfies the board. I can answer any questions so you have.
All right. Thank you, Mr. Stoddard. I appreciate it. Jim Greffy, our health agent, is not able to be with us tonight. I do have some notes from him. So I'm going to just review those real quick, or share those with everyone, and then we can get to board and public comment.
Oh, do you want me to stop sharing? I'm sorry.
No, you can leave it up. That's fine. Sorry,
Okay.
I was moving our audience tabs so I could see it as well. That's all. 18 Middlesex Drive from Jim Greffy. The sewage disposal system for the house would be considered in failure based on the soil testing conducted at the site. The system would be in the high water table. Soil testing conducted for the design of a replacement system noted groundwater at 36 inches and the estimated seasonal high water table at 22 inches below grade. The high water table prevented a perk test from being conducted. A soil sample was taken to conduct a sieve test in order to determine a perk rate. The site has other constraints, making design of a replacement system in full compliance with Title V and our regulations extremely difficult. The lot is small. House's location is centered on the lot, and there are wetlands to the rear of the property. The applicant's engineer has revised the plan to replace the septic tank with a secondary treatment unit, a Jet J500 system, to comply with the board's regulation. The treated effluent will discharge to a geomat leaching area. The geomat will allow a reduction of the system grading. This is being done by using pressure dosing to distribute the effluent to the field. The breakout fill is reduced from 15 feet to 2 feet, allowed by DEP approval of the geomat system. Requesting the groundwater offset reduction for the leach field from 4 feet to 2 feet. The existing house is remaining, and the design minimizes the potential for surface water affecting the abutting property or the house. The treatment effluent will reduce the strength of the wastewater discharge to the leaching area. The area is served by town water, and the new leaching area will be located above the water table and receive treated effluent. This is a reasonable solution for this site. At this point, we're going to open it up to board member discussions. I'm going to go alphabetical if that's okay, just to keep it simple. So we're going to start with Kevin Davis.
I have no further questions.
All right. Gino Fratellone. And say if Brenda or Gino are there. I'm going to skip to Matt Wason for the moment. Matt Wason?
I have no further questions. I want to thank Chris for going above and beyond and putting a lot of extra work in on this to try to address our requests. I really appreciate it, and I appreciate the homeowners' willingness to go to a system like this. It just thank you very much.
No, not a problem.
All right, I'm going to return to Gino Fratellone. Gino, any questions, comments about 18 Middlesex Drive? All right. Nothing from Gino. The chair has no questions other than the comment of, again, thank you very much. It's so many of these houses are on very, very difficult lots, and it's a challenging neighborhood to be in fully compliance. So thank you for all your work and for the homeowner to get this to be as efficient a system as it is on a challenging property. So thank you for all your work, and I don't have any questions. So unless we have any other discussion, I'm looking to the audience. I see no hands raised in the audience for public input. The chair will entertain a motion.
I will make a motion to approve this system as presented with variances for reduction in groundwater offset from 4 feet to 2 feet, use of a sieve analysis, and reduction in the distance from the house from the system from 10 feet down to 5 feet, correct?
Yes, that's correct.
That's my motion.
Mr. Chairman,
Mr. Davis.
I'd like to offer a friendly addition to also request a 2-foot reduction in groundwater offset within 100 foot of the BBW.
That's not acceptable, Mr. Wason?
Was that
Is
an
that on the
additional?
list?
Yes. But amend my motion to also include a 2-foot reduction in groundwater offset within 100 feet of the BVW.
I
All
second.
right, I have a motion and a second. We do a roll call vote. Kevin Davis,
Kevin Davis says yes.
Gino Fratellone, welcome back, Gino. Do you have we currently have a motion and a second on the table to approve the request as presented. I'm going to circle back to Gino. Matt Wason.
Now, Mason, yes.
Okay. Gino Fratellone.
Hit again.
Okay,
Brenda, if
I okay. You're talking about what, the 710 or the 720?
We currently have a motion and second to grant the variances and waivers as requested for 18 Middlesex Street.
Okay,
Say yes.
I say I approve.
Gino, did you hear the motion?
Well, I went to the men's room, so I
Would you
missed
like
it.
would you like to abstain, or would you like us to repeat it?
Do you want them to repeat it?
Okay. First, I gotta find out the right one. It's a 7:10 p.m., right?
Okay.
18
G-
Middlesex Street.
Gino, I'm going to ask you to abstain from this one, if that's okay.
I will say okay
Yes.
because I heard before you guys talking, but then I had to go to the bathroom.
Okay, so voting in the affirmative.
Yeah. Okay. I have no problem with it. 18 Middlesex Street. That's it.
Okay, thank you, sir.
Okay.
The chair votes yes. That is a majority of the board has voted in the affirmative.
No
The
problem.
waivers and variances are approved as requested.
Fantastic. Thank you folks so much. Have a wonderful night.
Thank you, sir. I appreciate it.
Have a good night.
You walked away. Thanks for doing
I know, I couldn't help it.
it. I think your mic is on there, on your
It
phone.
is on.
If you want to mute it.
Something's on.
Brenda, your mic is on, Brenda.
Hey, I can hear from you.
Oh, mine is, sorry. I knew one of them was, thank you.
All right. Thank you, everyone. We are now at our 7:20 hearing for 23 to 31 Stephen Street. It's a continuation regarding a Title V waiver and a shared system agreement for those properties. Looks like we have Thomas Gibbons, excuse me, I apologize. Presenting for the petitioners. Give Zoom a chance to catch up. There we go. Good evening, attorneys. Welcome back.
Thank you. Good evening, board members. Tom Gibbons and Emily Langlaise for Thumbtack Realty. You may remember that we were before the board at last month's meeting. And what we're requesting is a Title V waiver for 1 Adam Street and 23 to 31 Stephen Street. As you know, these properties are on the proposed municipal sewer line, and I believe the pipes have been started to be installed there. So I realized that we just got this proposed agreement to you today, and you probably will need some time to review it. But I wanted to hit the highlights. What we talked about last month was having an agreement that would require that the current system be inspected every month, that it be pumped every 2 months, and also if during the monthly inspections, the inspector determines that it needs to be pumped more than every 2 months, or if he's out there and sees it needs to be pumped, that we will pump it then also. We've also provided a right for your board to have access to the property upon 72 hours notice. It would be, we've provided my contact information. I'm here in air so that, you know, you wouldn't have to chase anybody around. You get a hold of me, and that would be sufficient for the notice. We've also provided for Thumbtack to deposit $60,000 into my IOLTA account to be held for various things, particularly if the board determines that there is a imminent health hazard, that the money will be in my account and will take action up to and including installing a tight tank. Our hope and belief is that that won't be necessary, but the money will be in my IOLTA account. So again, you don't have to worry about trying to figure out who has the money.
All right, thank you very much. Just some small amount of background information. We do not have any further information from Jim. It looks like from the email trail we saw this afternoon that this came to Brenda's office via email at 4:37, which is after standard business hours for town hall. It came to the board members at 6:49 p.m. So I certainly, for one, other than acknowledging that it was received, I have not had a chance to read it prior to this meeting. I'm not sure if any other board members have had the opportunity to meaningfully review this in the 11 minutes prior to our meeting start.
It was also not available in the packet, so the public have not had a chance to review it. So I would like to make a motion to continue.
I have a motion to continue.
Second, and I'd like a discussion real quick.
We have a motion and second. Let's discussion. We have a request for discussion for the motion. Mr. Davis, your request, please. feel free to
Also,
start.
I just refreshed my memory from the previous one. I thought we were also going to need the approval process for the hooking up to town sewer. Is that right? Wasn't that part of it also, part of the discussion, or am I misremembering?
I believe at the moment, we believe the current waiver process is fine as is. However, there currently is not a legal entity to make that request, since this is a shared system that legally does not yet exist.
And
They're
then
coming before today with this shared system agreement, which requires approval for us to approve. It now becomes, for lack of a better descriptor, a legal entity who is then has standing to make a request for the Title V waiver septic or sewer system tie-in gap coverage delay. So that's kind of where we were. It started with a simple request. We realized that how do we do this with two separate businesses? Who is responsible? So that was kind of where we are in this process. So the waiver process really is unchanged. We just don't, even as yet, until this is approved, have a body of standing to make that request.
Thank you. All set.
So and I'm gonna, again, I don't have town council here, but we do have the two attorneys. Does that sound like where we are? And is that kind of your understanding as well as kind of our process and what our challenge has been and how we got here today?
Yeah, so and Emily's been involved in it longer than I, but are you, so I'm not really sure exactly what you mean other than what's in the agreement. Are you talking about having someone other than the Board of Health have authority in this case, or?
I believe the question, if I can speak for Mr. Davis, was that the waiver process was because this is a little bit different. It always is something a little bit different. We have a waiver process that comes down from the state to allow these 48-month gaps between a failed system and tying in if it's anticipated that a public system will be available within a foreseeable future. So the question came up is, how do we make this work with this unique system where if it was a pre-existing homeowners association, it wouldn't be a unique system. It was simply had to create the shared system first before we can grant a waiver to connect that gap waiver. So I think that was a discussion, Mr. Davis. Is that kind of the way what you were thinking and what the challenge was when we first started this process and how we got to we needed to have the shared system agreement
So
existing?
okay, I'm good with the discussion. I'm all set. So the
Mr. Mason?
I was going to say, technically the system's not failing, correct?
So the system is technically failing, but there's no breakout. So my understanding is that the separation in the cesspool is less than 6 inches from the inlet pipe.
Right. Okay. Yes. So you will
I
be
believe
going through
it is
the waiver process eventually once you're an entity that can request the waiver process. Cool.
Well, so just to be clear, so this agreement would be in place until we connect up to the municipal system. And so what I've tried to provide is funds that I will hold in my attorney IOLTA account. Contact with me. I have authority to use these funds for various things up to and including the installation of a tight tank, again, which we hope will not be needed, but.
So we have a proposal and a second on the floor because I seconded the motion.
We have a motion and a second, and just to clarify, so this is established is for the approve is to continue the hearing.
Yes.
But when we return to our hearing in 2 weeks, that the system is approved, it will still require, because it is still a Title V failed system for property transfer, it will require a Title V waiver and pending connection to municipal sewer. So there is still be another step, it sounds like, in the future once this is in place. This is not replace that Title V waiver. This is simply getting us to the waiver, I believe, right?
Yeah, so this was covered.
So I think, so our intention is that this would cover both, the waiver and the establishing of funds and requirements, and that we would record this at the registry of
So we
deeds.
have a specific form and process for that to happen that was approved by this board.
But specifically for the Title Wave 5, disregarding all of these other requirements.
At the moment, we have a motion and a second to continue. I think we can clarify with Jim Carefree, our agent, and town council if we have any further questions prior to coming back in should be 2 weeks on the 28th. Any further discussion on the motion to continue?
Oh, good. For me, sorry.
All right. I don't see any other hands. Roll call vote for the motion to continue. Kevin Davis,
Kevin Davis votes yes.
Gino Fratelloni,
10 days, yeah. Gino Farallone.
Matt Wason,
Now, Mason, yes.
and the chair votes yes. Thank you very much, and we'll let you know if we have any questions.
Thank you very much. Have a good night.
All right. Thank you, everyone. We are at our 7:30 hearing for 16 Cedar Street. Looks like we have Ted Doucette of Doucette Engineering presenting for the petitioner. I don't see his hand raised, but I'm going to promote Mr. Doucette anyway. And Mr. Doucette, if you are there, welcome to our 7:30 public hearing for 16 Cedar Street with a variance request, reduction in groundwater and reduction in the inlet and outlet pipes for 16 Cedar Street.
All right, good evening. Again, Ted Doucette, Doucette Engineering, representing the homeowner, Susan Bottomley, who is not in attendance. I can share screen. All right, sounds good. All right. So this is a lake lot. It's at the top of the hill on Cedar, up the hill from the lake. This is Cedar Street here, and this heads down to the lake. Currently, there is a septic tank in the back here with a bunch of concrete chambers that have a leaching area attached to them. It's in failure. They're getting ready to transfer the ownership, and as we went through this, obviously we have the septic system designed, and we have a couple of waivers due to the size of the lot and due to the groundwater elevation. I don't know how much you want me to go through. I did attach the the full waiver request. We could not get a perk test in here due to the depth of groundwater and the depth of the naturally occurring material. So we did submit to a laboratory according to the alternative to perk testing policy with the state. And we came up with a, what was it? Sorry. So we came up with, it was a Sandy loan, which puts out a 0.33 application rate. It is a 2-bedroom existing. It is going to stay as a 2-bedroom. The proposed system is going to be a Presby infiltration system here. We're going to have a tank in this area, and we're going to have a pump chamber that needs to pump it up to the system here. We will be utilizing a impervious barrier here set 5 feet off from the edge of the system. And that's so that we don't have to relocate this stone wall that's in here right now. It's just a stone wall there with, it's just a bunch of natural boulders placed up there, but it's very stable and has been there for a long time. So there's a couple small trees that'll need to be taken down. So the variances that we're asking for is the groundwater was high down here, and it's going to be the groundwater is less than a foot below the invert and outlet of the proposed tank. So if you have that, you have to have it, you just have a variance. There's nothing else we can do. We can't raise the building sewer. We can't raise the tank at all. We can't lower the groundwater. So that's where we're at. What we do to help protect this in this situation is to make sure that to put belts and suspenders on this. These are the areas here where the pipes are all connected. They're rubber boots. They're very watertight. They hold very well. But we usually, in this situation, we've done it in Littleton before, done a few other projects, pour a bag of concrete around the pipe inlet here. So you just, you backfill it, and then you just clear a little area, that you can get mix a bag of concrete and throw it in there. So we'll do that on all the inlets and outlets just to provide belts and suspenders. And then the other offset, the other variance is it's required by Presby that the Board of Health approve the 2-foot reduction that's allowed by Title V. So that's why these always go to Jim. A lot of other towns, health agents will approve these, but Jim says, it's a formally in the Board of Health. It says there that's formally Board of Health, so we all come here for this. But nothing that's not allowed by Title V.
All right. Is that the end of your presentation, Mr. Doucette?
Yeah, pretty much. Yeah.
All right. Nope. That just double checking. I don't want to cut you off. You had more to share. At this point, I'm going to open it up. Actually, I apologize. I'm going to read Jim's notes again. Jim Gruffy, our health agent, is not able to be here this evening. Nope. Ted, do you have a question?
Sorry, I do. Yeah. So I did. I forgot. Sorry. Jim did send his notes. I have the notes that are dated February 9th. I did get plans to him, I believe, yesterday. So with a chance that he got to him is probably nil, but these are the revised plans here. So I incorporated his things. And if you want to go through them, then I can show you how we addressed them. That's fine. I'll yield back to the chair.
Thank you. So I will share before we go to the board that the board has not seen these plans until 5:05 this evening. So I'm not sure what the pleasure of the board is. And if I do not believe we have updated notes from Jim. If you've revised your plans, I don't believe we have updated notes from him for feedback, whether it's has met his requirements. But let me read his notes and then we can work from there. So 16 Cedar Street, Littleton. The sewage disposal system at this site is in failure. The leaching area is saturated and likely in the seasonal high water table. Soil testing was conducted and an area for replacement was found. The lot has a number of constraints which make the installation of a fully compliant sewage disposal system extremely difficult. The lot is small, the seasonal high water table is high, the perk rate is high, and the land slopes. In order to design a system within these constraints, the applicant is proposing the use of a Presby leaching field and requesting a groundwater reduction from 4 feet to 2 feet. Presby system allows the use of a sloping leach field and, in combination with the poly barrier, will minimize the soil needed for the breakout requirement. This is very important given the location of the leaching field, uphill of the house, to allow for the proper surface drainage around the house. Given the seasonal high water table noted and the elevation of the existing house plumbing, the outlet of the tank cannot be 12 inches above the water table. The applicant has proposed the use of monolithic tanks, and most tanks are now constructed with rubber boots to seal the piping to the tank to prevent leaks. The area is served by town water, and there are no wetlands within 100 feet of the leaching area. Proposed design represents a reasonable solution to the existing failing system. And these are dated the 11th. So it sounds like you've provided plans to Jim after his notes to us were prepared. If you said yesterday you provided the updated plans.
Yeah, yesterday or Monday. It was not before the weekend. No.
Okay. I'm going to open it up to the board. We're going to go reverse alphabetical, if that's okay, to mix things up. We're going to start with Matt Wason.
Sorry. So the plans in our packet are not what we're looking at here?
The plans in our packet
these are-
should be the most current. The packet that we received at 5 o'clock today was because we were waiting for these plans to be included, it sounds like.
Check. But Jim's comments don't seem to call out any ask for a change. Ted, what changed?
So I missed this. My draftswoman sent it in, and she must have pulled the offset from the fence, and so the septic tank was 10 feet from the fence, but it wasn't 10 feet from the lot line. So we pushed it over there, and you can see right here there's a 10-foot lot line setback. He mentioned that the pump may be a little bit large and recommended that I review the pump specification. So I did. I feel the pump is still adequate. He thought it was a little bit too big, and maybe a little bit too big, but I don't want to pay for restocking a pump, so I'm going to make sure that it's going to meet the need. And it'll also, if it's a little bit big as it wears, that it'll still be able to get the waste up to the leach field. The other one was something that I run into because a lot of times you put it in two places. So the barrier here is shown at 5 feet off of the system. I have a 2-foot overdig. I don't know if you remember, Presby does not require an overdig, but I usually put in a 2-foot overdig when it's above grade. And then my cross section here, though, originally showed the barrier right here. So here's my 2-foot overdig. I had the barrier here. So it was two places, and the same information was two places, but it was not the same in two places. So now I moved the depiction of the barrier out to here at 5 feet, and it's the same as shown on the plan view. So, yeah.
Okay.
So I'll just be, and to be 100% upfront, during this process, I did have one contractor looking at it, and he said that it would be difficult to get the tanks back here. It would be very expensive because you're either going to have to set a crane, which is difficult. You're not going to get a crane in here too easily, or we'd have to make a road and remove all this, move this wall and everything to bring a tank truck in here. So what I've proposed, I've put on here as an alternate is where these plastic tanks that are approved by Title V, I have them here and they're specified if the contractor wants to use those. And I even have the pump calculations if they're going to put in the pump chambers. So that's an alternate installation for them.
And that potential tank swap is also updated on these plans from what Jim reviewed?
Yes, right, because the comment from the contractor came in after Jim reviewed it. But
Okay.
so now that it looks like we want to do that, I'm like, all right, well, let's throw it in there just so Jim knows it and he's not surprised at it. We're not trying to explain stuff in the field, right? So the tank details are right here, and then you can see an outline where it will fit here. There's an area for the septic tank, and here's an area for a pump chamber just to show that it fits.
I see. Okay, so those are the alternate type tanks.
Yeah.
Okay. And my one other question was your reduction of groundwater offset from the outlets to the groundwater less than 12 inches. What is it going to be?
3 or 4.
Okay. I think that's all
I mean,
my
we
questions.
just well, I mean, here's the estimated seasonal groundwater 10332 here, and then here's the septic tank. Oh, so it's actually below seasonal high groundwater. Sorry. I'm sorry. Wait a minute. That's up there. That's the high groundwater up there. I'm sorry. Let's double check over here. Deep test hole 2. So here's the deep test hole 2 that we've conducted down near the tanks. Seasonal high groundwater in that area is 9902. So, and then the septic tank. So you got barely a foot there. You got less than a foot here, and then the pump chamber is about 7 or 8 inches.
No further questions. I think I'm okay with everything, but the list of changes started to get longer and longer that Jim hasn't seen. So I would just say to our board, I would probably feel more comfortable if Jim had another review and just gave us comments about it.
All right. Thank you, Mr. Wason. Mr. Fratellone, any questions or comments?
I don't, something, I know the area is very tight. I think the engineer will do the best he can.
Okay, thank you, sir. Kevin Davis.
Hello. Thank you for coming before the board. Real quick, are the alternate elevations for the alternate tanks the same elevations as for the standard tanks?
Yes. Yeah.
Okay. And because it's the within 12 inches of the ground, are the alternate tanks also booted?
Yes, they'll be booted and concreted.
Okay, the plan's not showing concrete, but okay. But you said they are the alternate tanks are booted, so okay, that's like
Yep.
you said, you're going above and beyond pouring a bag of concrete around it, so I get that. All right. And then I have no further questions.
All right, thank you, sir. From the chair, just a quick kind of technical question. Do the alternative polyethylene tanks, Jim's notes certainly talked about a monolithic tank, which we talk about with seams in concrete and obviously a harder manufacturing process to make a single pour tank than it is for plastic. I'm assuming the plastic, the polypropylene tanks are considered monolithic, sealed, no seams, all that good stuff.
No, they are constructed with 2 parts. They are shipped in 1 part. They are sealed together with a boot, and then they are wrapped with a belt around the seam.
And that's considered meeting the same monolithic criteria, kind of.
I'm not going to say it's monolithic. It's still a 2-compartment tank, but it is double sealed.
Okay. And we've heard from the board members. One moment. I apologize for the background noise. I have no hands in the audience. What is the will of the board?
So I would like to have the plan reviewed again by Jim. That's my main thing. I mean, and then the fact that the polypropylene tanks aren't single. I mean, if Ted, if you say that the tank itself is when you put the belt and suspenders or the belt around it and it's sealed, if that becomes monolithic, like it's treated as monolithic, like it becomes engineered monolithic, then I feel more comfortable about that because we are so close to the groundwater. But yeah, that's kind of where I'm at with that right at the moment.
So monolithic has a strict definition.
Yep.
It's one piece, right? So I
Right.
can't say it's monolithic. Is it sealed tight enough for me enough to put my stamp on it to say it won't leak? Yes.
Okay.
So if I could make, as long as I'm speaking, if I could continue, we're here mostly for the variances. So I think it would be very helpful for the homeowner so she could kind of get mentally planning for this and not be delayed for another hearing. Jim's obviously going to look at this because once you revise plans, they got to go back to him, right? He's got to address his comments. So I think that if you could approve the variances and then once he approves the plan, then, he can prepare the permit and then the board can sign it. And then if he has anything at that point, if he has any other issues at that point regarding the plan itself, then he won't be signing the permit. So I would like to get a vote on the variances tonight and then leave the permit to be issued upon Jim's review of the revised plan.
That works for me. So I make a motion.
Before you do, Kevin, we got this drawing late today, so I know it's in our packet, but was it in the packet soon enough for the public posting? I didn't think we could change the packet the day of the meeting.
Dan, we can't hear you.
Sorry,
You're not
thank you. I was.
Sorry.
The agenda, as long as the agenda clearly describes what is being discussed, what's included in the packet or not included in the packet is, I do not believe, pertinent, as long as the agenda adequately describes what's going to be discussed. Does not need to be down to minutia, but enough that an average person could look at this and realize kind of what the discussion is going to be. So from a packet perspective, from open meeting law, I think we're okay because the application, the agenda was posted obviously in a timely manner. That being said, I can let Mr. Wace, if you want to continue, if you have any other comments before
No, sorry for the interruption. Kevin was going to say something.
No, all good. So what I was going to say was I'd like to make a motion to allow the reduction in vertical separation distance from 4 feet to no less than 2 feet for the Presby, and to request relief for the septic inlet and outlet pump chamber to be located within 12 inches of the groundwater, and to request that before the permit is signed, that Jim re-review the submitted plans.
Mr. Wason.
Would you
I second it.
consider
This is
adding
Gino.
variance for sieve analysis? Did you say that?
I don't believe that's a variance. That's an alternative policy. I don't believe that's a variance. I've never requested a variance for that in 20 years. I don't think. Maybe I
A
have.
sieve
but I don't think
analysis
it's
in place of a perk test is, it's a
That's a variance.
Every week.
to accept a
actual
sieve
variance.
analysis in place of a perk test.
That's not listed on the variances on the print.
So we do have a motion and second. Do we have any discussion on the motion? I would like to speak up. I'll speak up first. I do have a process concern. Only in that if we approve The reason for the plans that it's before us is proximity to the groundwater, and then the offset pieces. So it sounds like we have questions about which tank is going to be used, whether a poly tank meets the technical definition of monolithic or not, as Jim shared in his notes. And again, this is one of the challenges of not having him with us this evening. And I, at the moment, can't change that, but hopefully soon enough, we will have our agent here at each of these meetings so we can address them a little more contemporaneously. But I have a process question. If it's approved the variance tonight, and then Jim then says, nope, this does not meet the requirement, the variance has already been voted on and approved by here. So Jim, to try to basically stop a variance that has already been granted, I guess I have a process question. I am not saying this is correct or incorrect. I'm putting this forward as a question to the board as a process piece. If we're granting,
So it's really easy.
variance.
I'll withdraw my motion. That's real easy.
I really am truly just asking the question that
I'll withdraw it.
how,
That's
how-
easy.
from a process piece, how would that work unless we make it contingent upon Jim's approval? Because we can certainly give a provisional approval and basically empower our agent based on what we've heard tonight and his approval of the changes that were received to his office either yesterday or today. That is also an option. I just want to make sure that we're thinking ahead, because I don't want to put Jim in the place of going, you've got signed variances in your hand, and now he's in the place of trying to say no, that this is inappropriate or has more questions or would require or recommend additional changes. I don't want to put him in a challenging place, and I don't want to put Ted and the homeowner in a challenging position of going, I've got variances and now I'm getting more questions. This isn't fair to anybody either. I just want to make sure we're all on the same page and our process is
So there's
reasonable, safe.
there's a real easy thing here. The sieve analysis. Ted, did you use sieve analysis in substitution of a perk test?
Yes.
So there's a local upgrade approval that we just went through on the previous one is CMR 15405 section 1 subsection I. It's use of sieve analysis and substitution of a perk test. So it's
Does
there.
it say that's a variance though? Does it say it's a variance?
Local upgrade approval,
Right. So that's what we're here for. Okay.
but it's not listed on your print.
Okay.
And it wasn't, and I don't believe it was in your cover letter. No, it's not in the cover letter.
No.
So I'm going to withdraw my motion then. And I'll make a motion if I can do that, Mr. Chair.
we had a motion and a second, can't be withdrawn. We have a motion and a second. It requires a vote to take
Okay.
action or not to. That does not mean we can't take further action once this motion is settled. And quit it, Kevin. You're making me pull out my Robert's Rules of Order. I hate that.
Sorry.
All right, so we have a motion and second. We're going to do if there's no further discussion. I see no hands in the audience. We are going to take a roll call vote on the motion on the floor, and then we'll take any other action as the board deems required. So roll call vote, starting with Kevin Davis.
Kevin Davis votes no.
Gino Fratellone.
I say yes.
Matt Wason.
No, isn't no.
And the chair votes no at this time. The motion to approve the variances as requested is denied. Any other action that the board would like to take at this time?
I would make a motion to continue this, to amend the print and to get clarification from our health agent.
Second.
Okay, we have a motion and a second on the floor to continue the hearing pending further input and review from the health agent and then back before the board.
Second.
So, oh, you gonna vote that? Go ahead.
Any discussion from the board before? Seeing none. All right, so we're going to take a roll call vote. Kevin Davis.
Kevin Davis votes yes.
Gino Fratellone.
Yes.
Matt Wason.
No, isn't yes.
And the chair votes yes to continue the public hearing for 16 Cedar Street. Mr. Doucette, I know you had a comment.
Yeah. So we need. I think you're supposed to continue to a specific date and time when you continue hearing. That might be for something different. But so as far as the process, so from spending 6 years on this board, I know that you're approving, right now we're asking to approve a variance. So that variance can be approved, whatever. The plan itself, you're not approving at this point, and the plan has to go back to Jim because Jim's not going to issue the permit until he's happy with it. So if he gets this back and he doesn't like he doesn't like the plastic tanks, then he'll let us know and do whatever he has to do about that. So it's kind of two separate things where if I had gotten everything on the plan properly tonight, you could have approved the variances, gone back to Jim and issued the permit afterwards. So it's kind of convoluted. And if this is cleaner for you, then, I'm not going to argue it. I'll have the new plans in there tomorrow and a new letter, and we'll wrap this all up in 2 weeks or whenever you schedule the next hearing.
Dan, you're muted.
I am sorry about that. Radio in the background. I apologize. Our next scheduled meeting is February 28th. I'm going to ask Brenda to please place the continuation of 16 Cedar Street on the agenda for the 28th of February and confirm that with Mr. Doucette.
Yes, and I'm out of town that week, so if everything's approved, I won't show up, and if it is not approved, then I will have someone here representing me.
Acknowledged. Thank you, sir.
All right, thanks.
Give Mr. Doucette a chance for the Zoom to catch up. We are a few minutes late. I apologize for that. We're at our 7:40 discussion regarding the Title V waiver agreement process. Not sure who was leading this discussion. I believe this was still the public sewer system connection discussions, although I'm not sure if we have further discussions around that. I think we kind of had gotten to a good place at our last one as far as process, documentation, and those pieces. But do any member of the board have any questions, comments, concerns, or feedback regarding the Title V waiver process? The Title V waiver agreement process, which again should be a failing Title V system for whatever reason, actual failing or a Title V property transfer fail, pending connection to public sewer. Okay. Seeing no discussion on the Title V waiver process, we're going to go to our 7:50 discussion, the model Board of Health regulations for private wells. I know Kevin Baker was working hard with the Agriculture Committee, some of our agricultural partners here in town. And unfortunately, Mr. Baker isn't able to be here this evening. I have not seen any updates from him from either the agricultural partners, our agricultural commission, or some of our community members who had volunteered to share some insights and thoughts as well. I've not seen that consolidated piece yet. I'm not sure if any other board members have. No. Again, if there's no disagreement, I'd like to table that discussion until our next meeting, and hopefully Mr. Baker can be here and share his insights and experience and what information he's gathered and collated from our partners out there.
So moved.
All right. To say discussion technically, and thank you for keeping me honest, but I don't think we need to. I think a simple table is good for that one. Just making sure. Again, you're making me break out my book, and I hate that. That gets us to our 8 p.m. ID decision support tool discussion.
Okay, so we are fortunately coming out of respiratory illness season a little kind of across the board. COVID-19 predominant variant is still Omicron JN1 at 75% of our cases out there. That's all there is. There's a little bit of HV1 and a couple of stragglers of others. This is updated. We're now going to report weekly case counts for the town of Littleton. So it used to be a 2-week rolling count. That data source has changed. So now it is simply number of positive cases reported each week, the week ending the date that's shown here. So for the week ending February 3rd, we had 4 cases for that week. That's a bit more of a lag than I thought I would see, because I thought we'd be up to the 10th, but I'll keep an eye on that and see if we can get a little tighter to where we are, because that's obviously 11 days ago still. Vaccinations, our COVID vaccinations have touched above 30%, but that's about it. I kind of feel like as the season winds down, unfortunately, I don't expect that number to go up any further. I think tactically we should try to figure out some better plan for next season. Not that you can't still get it right now, but as the kind of fall season rolls around, I think 30% is a failure for our community to be that as our COVID vaccination rate. So I think we should be brainstorming over the summer, potentially with our new health director, to try to figure out how we can drive those numbers up. I'm not sure if that's access, or if it's apathy, or if it's disinterest, or what it could be that's driving such a low number. When you compare it with our influenza vaccination rate, which, while still below our goal, is at 50%. So that's a big difference between those two in terms of community members who see the importance of getting their influenza vaccination, but don't see the importance in the COVID vaccination. So I think there's work to be done for us next year. Wastewater numbers hovering about 1,000. That's the other one. We have new sources of data, so I'm going to work on getting that updated for the next one. Sorry, I skipped past ICU bed access. I cannot find a replacement for ICU bed access from the DPH side. Dan, do you by any chance know of a reporting site that has that information?
I don't off the top of my head.
Okay.
I'm sorry.
I'll keep looking, but this is effectively going to just drop off because I am not finding. Basically, DPH replaced bed access and any sort of hospital metrics basically with ED admissions for respiratory illnesses, which if we want to see, I can put in there. But that's about all they're providing now. So I'll keep trying to see if there's anything more meaningful, as it were, or at least if we can, similar to this, look at the hospitals that are servicing our community more closely. But unfortunately, I think that this one's done and gone. So influenza still at moderate, which is the same as it was 3 weeks ago when we last met. And there's our vaccination rate. And then RSV chart over here on the downturn. That season looks like it's kind of wrapping up. It's still out there a little bit. But RSV did not hit us quite as bad as last year, which is a good thing. And DPH is reporting some RSV vaccination information, but as that is not recommended for all individuals, that's only specific age groups and patient populations. They don't have a denominator yet, so I can't report a percentage. So I'm going to keep kind of pinging to see if we can get that, just so we're aware of what that rate is for our community. But that is going to stay that way for now. What was I going to say next? You're going to come back to me. The only other piece I wanted to raise was there was a news report recently about basically childhood vaccination rates in schools across Massachusetts. And it was highlighting that there were a bunch of schools that were not meeting what the recommended percentages were. Littleton is not in that category of not meeting those targets. However, as I looked at it, I started to wonder, is it something that we should include in here, as this is kind of expanding to include kind of some vaccination rates? The tricky thing is that Massachusetts reports it at kindergarten level, 7th grade level, and high school level, I believe, which splits, like, obviously we have 4 schools, not 3 schools. So it splits that differently. And I'm not sure if that's valuable data, or if we should, if we're interested in kind of reporting on that, even if it's just an annual basis, should we be getting that from each of our individual schools, just so that this board has awareness of what is out there in the community? I throw that out there as a thought. I don't think we necessarily need a decision right now, but if people are interested, I can pursue it.
Makes sense.
If it makes sense.
That may also be something that we can work with our new health director, health agent, to perhaps we can start building some of those relationships to, provide information both ways between the school nurse team, who probably has a lot of those numbers at the tip of their fingers, where we may need to work harder at it and make those connections. So maybe there's one of those pieces where we can leverage that relationship and, kind of have a little bit closer to the ground folks being able to share information back and forth.
Oh, yes. I was not going to try to figure out that data. It was going to be, please, could we just ask each of our schools nurses to give us that data? And I said, even if it's once a year, is that something that this board should just have on the radar to report and understand each August or whatever it might be? Kind of as I'm going back to the COVID vaccination rates of, how does this board and our future health director know where we need to potentially spend energy and resources in improving. So until I kind of saw that news article and decided to check on it, I probably wouldn't have known, and that's not responsible. I think we should be better informed than that. So whatever else that did not come back to me, so I will stop there.
Any comments, questions from?
Thank you as always.
Brenda, if you're still here, could you figure out, and I apologize, I'm trying to listen and work the board as well. Just move Mr. Doucette back to the audience for me. Sorry.
Sure.
Just other thing I can add is certainly the last data we had for statewide COVID data was ending the week of February 3rd, and there were 2,792 new confirmed cases and 37 deaths during the week of January 28th to February 3rd. So almost 2 weeks out, because as we said before, that the state data comes out on Thursday, and we meet, of course, on Wednesday. So we're a week behind, and certainly from a hospital capabilities perspective, there are some internal dashboards that are shared at the hospital and emergency operations center levels, but I'm not sure how public they are. I'll see what we can find for public availability of that data. Again, purely anecdotally, that for most of the folks I'm talking to out in the world and from my little hospital, that the challenges of throughput and dischargeability is still pretty significant across most of Eastern Massachusetts. So patients who are hospitalized and needing lower levels of care are having difficulty finding skilled nursing facilities or nursing homes, for example. So patients in hospitals can't be discharged, which means patients in the emergency department can't get admitted, which means emergency departments are backed up and hospitals are full. So and it's pretty consistent across most of the country, but particularly here in Massachusetts and Eastern Mass, where we can refer to kind of real anecdotal data, at least, is that it is challenging. So please do your best to be safe, utilize alternative care settings, urgent care settings, your primary care office the best you can, telemedicine and virtual visits, but save the emergency departments the best you can for true emergencies, only because it is a challenging environment across our healthcare institutions right now. So. All right. Any other questions, comments for Matt about our ID decision support tool? Nothing. We still have Brenda. Did we lose? We may have lost Gino. We do still have quorum, so we should be good. But hopefully, Gino is in the background with Brenda. Okay, great. No, we lost his phone, but I was going to say, as long as he's still around, that's good.
Yeah.
All right, that gets us to administrative matters. So we have a number of things. We have some minutes that were in our packet. I have a couple questions I'd like to bring forward. Administrative process piece and some correspondence. If it's the pleasure of the board, if we can start with the minutes as the first administrative matter. So I'm going to share my screen. Apologize for mumbling to myself while I do it. All right, can we see my screen? We should have the meeting minutes for April 12, 2023 draft up. Are you able to see it? Thank you. All right, so yeah, we're unfortunately very, very far out of or delayed in approving or reviewing these minutes. But so I have the meeting minutes from the packet for April 12, 2023. Any comments, concerns, I'm scrolling. I realize I'm
Apologies, I have
scrolling
not
quickly.
had a chance to review these minutes, so cannot responsibly vote on them.
Okay. I was gonna say the packet did come out relatively, while the packet, I believe the minutes I believe have been in the folder. I believe they did come out.
They were
relatively
posted. I didn't get to
late
them. Yes.
today. So, what is
Mr.
the,
Chair, the only minutes that were posted today in the folder was 412. But 614 and 628 have been in the folder for a few weeks, at least a week.
thank you, ma'am. I'm scrolling down to the end for a moment. I realize we haven't addressed this. I don't believe we've addressed this in the past. And I'm going to need to go back and look at the open meeting requirements. I believe that open meeting requires a list of all documents presented during the meeting as listed as part of the minutes. I will need to go back and double check that, but I believe that is a minute requirement that, if we refer to a plan, that we need to list what plan it needs to be in the minutes of what plan we're referring to, or what document, those kind of pieces. But I will double check that open meeting requirement for minutes. So we have the April 12th, 2023 minutes before us. What is the pleasure of the board?
Well, I reviewed the packet and it had that in there, and I read through the minutes. I don't have anything right with these. I'm fine with what's here.
Okay,
Well,
sounds like Matt Wason wants to abstain for the moment because he has not had an adequate chance to review them, and Gino was not present for this meeting, so
we're gonna
I
have
do not
to,
believe,
yeah, we're gonna have to skip the 12th then.
and Mr. Baker is not here. So unless, and I'm not asking you to change your mind, I just want to make sure before we
Oh, good. Oh, good.
table this one, if Matt would like additional time to review that, and that's perfectly acceptable and appropriate if you desire that we table April 12th, 2023 until our February 28th meeting for review, so we have time to review that one.
Fine with that. We can table it.
I apologize for the quick scroll. We're just going to move to our next set of minutes from our packet.
My apologies for the lateness at 412.
All right, I have June 14, 2023.
I'm abstaining because I wasn't there.
Any discussion from the board? What is the will of the board regarding the June 14, 2023 meeting minutes?
Similarly, you only have 2 members able to vote. Like I said, I have not reviewed them and cannot reasonably vote. And Kevin Davis was not present. So I feel like we have to bump them.
Okay, we're going to table the approval of the meeting minutes for June 14, 2023 to our February 28th meeting. That gets us to our June 28, 2023 meeting minutes. Again, Matt has the desire to further review them prior to approval. What is the will of the board?
We can table it. I have no problem tabling it.
Okay. general verbal agreement with placing hold on June 28, 2023 to our February 28th meeting for review and tentative approval.
Sounds good to me.
All right. I believe that gets us to the end of our packet, and we are now at.
So so in the packet, it looks like there's this report on a release notification.
We did. Thank you very much for getting to my next piece of correspondence. So, we have finished minutes. We're going to pull off on our just reporting on the health director position since we kind of already hit the status of the position, and our 25 budget. I think we definitely need to look at what that's going to look like. Obviously, the 24 budget discussion just is in process, but it's basically near completion between select board and FinCom to go getting ready for the warrant to go before town meeting. I think as we get our director in place, I see us really having a vision meeting of what are our priorities, what are our first steps professionally, what is the health department's first steps, whether that's, needs analysis, gap analysis, state of the community kind of piece, whether that's a vision for the department of how we start building that transition from shared services through Neshoba and start bringing those things in house, and how do we build our back net, our backstop in case there's challenges meeting the expectations. I see us having a bit of a retreat and kind of a vision process once the director is in, has a chance to meet many of the players and gets a sense. So we can talk about 25 budget, but I think that's probably kind of where we are with that one. So let's jump to correspondence, and we can come back to some administrative matters for that one, and I have a few others. So we did get two pieces of correspondence of significance that I've seen, and please share if we have any others. The first was for a 50-gallon gear oil release at 149 Air Road, which is the quarry. The report received that it has been cleaned up, appropriately disposed of with Commonwealth approved mitigation. The upside of having it there is that it is a relatively easy cleanup since it's all gravel. So they were able to contain it and clean it up relatively quickly. And it sounds like no further action is required. I did make sure that the report went to Jim as well to see if we needed to do any additional monitoring or follow-up, either independently or in conjunction with DEP. The other piece of correspondence we got was for 55 White Street here in town. And that I'm not sure what the process of the investigation was, but they found they were positive for PFAS in the groundwater. It doesn't sound like it's a new release. It sounds, again, I'm not sure what the process was for testing the groundwater, but it did come back as positive. So it may have been an existing test well. We only kind of got the executive summary side of things. So again, we've included Jim on that correspondence, but it does continue to bring forward certainly concerns for potability of water, certainly groundwater and well water here in town, that we have groundwater contaminated, in 55 White Street, which is, for those who haven't looked at Google Maps, it's the backside basically of the common area near 495, that side of the common. So I know in the past, and please, again, anyone else have any further information, I know we've gotten positive reports within the last 6 months or a year or so of positive PFAS in one of the test wells at either Russell Street School or the middle school. I forget which one. I know it's on that general property, but I forget where the test well is. But so I'm not sure. And obviously we had the concern with our Spectacle Pond town well having a positive PFAS many years ago, prompting the dilution program from Beaver Brook and certainly speeding up a little bit the Whitcomb Ave treatment plant to manage that contamination. So it certainly is out there. it's a concern, certainly as we're looking forward of water quality, it's going to be an ongoing concern, I think, for most of our groundwater process here in town. I believe both of those were in the packet, or at least certainly provided to the board as we got them. Any questions, comments? Again, I'm not sure I have any answers, but anything we can bring forward to parties who may have answers.
So I'd like to bring forth a thing with the release notification. So I started reading it and was kind of, 50 gallons is essentially 5 gallons short of a barrel of oil. So just as a concept for volume size, it's an entire barrel of oil minus 5 gallons. So take out your 5 gallon Homer bucket off the top of that, and that's how much oil leaked out of this thing. So that's not that's something, right? That's not nothing. The other thing is that the community and everybody else was supposed to be, according to the rules, we were supposed to be notified within 48 hours following the implementation of the immediate response action. So, yeah, it happened on 12/4, and looks like we got notified on February 12th when you got the letter, and that letter was dated February 1st. So, per that little section that they've got in there, that if you wanted more public involvement activities under 310 CMR 40.1403, right in there is where, in 1403, right in there is where it's, it talks about what you're supposed to do as far as public involvement activities. So subsection 3, subsection B, it says the implementation of any immediate response action time to take, prevent, control, abate, or eliminate an immediate hazard as required in 4032-426 or to address a critical exposure pathway. And subsection 2, notification shall be made as soon as feasible, but in all cases, notification shall be made no later than 48 hours following the implementations of the immediate response action. So,
Does that define who needs to be notified? Is that local authority or is that DEP?
that is the Town Board of Health.
Thank you, sir.
It says right at the top. It says, so, and then subsection 3, it says, at any time after the department has notified, so the department is the Department of Health, it has been notified of release or threat of release pursuant to this, the Municipal Board of Health and the community in which the disposal site is located or communities, blah, 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 blah. So, yeah, we were supposed to.
Just confirming.
Yep.
It certainly is possible that perhaps Jim had been notified through the Neshoba side as our health agent. And that,
Absolutely.
adding that extra piece that it may have been, the rules may have been adhered to in spirit by notifying the health agent.
Absolutely.
But not necessarily by the letter, by having it then make it to the Board of Health as a Board of Health group. Because again, while regionalization is not new, it is still slightly different, so that I'm going to give them the benefit about short term, but certainly we can follow up with Jim to see if he had been notified in a timely manner as required, and if not, then we can kind of work with some education pieces and next step. Hopefully they never ever have to report another one, because they'll never have another one, but it's a big place with lots and lots of hydraulics that things happen.
Yeah, absolutely. I'm not saying that things don't happen, because things do happen, and that's the reason why they have the forms. That's the reason why you report it, all that kind of good stuff. So I don't want to not encourage people for reporting, spills of hazardous materials and things like that, because that's obviously what we definitely want that notification. We don't want them, not to have happen. So I get it, but I want people to follow the rules. So thank you.
I will follow up with Jim just to see if he and his side of things may have been notified, and kind of the spirit, if not the letter, was followed, just it didn't get it to us. So
Thank you.
no problem. Thank you, sir. Any other comments or questions regarding Air Road or White Street? All right, see nothing. I'm gonna double check, my tab moved over. Okay, nothing from the audience. Rebecca gets us back to administrative matters. So we talked a little bit about any other questions for our current status of our health director position and the process. As I said, is at this point, Michelle and HR, should have made the offer that the plan was after Monday night's Board of Health, or actually select board meeting. She was going to be preparing it and get the offer letter out, I believe yesterday, Tuesday, the 13th, and then would let us know as soon as we had any response from the candidate. Any other questions regarding that piece of anything? Obviously, as soon as we hear, I'm sure Michelle will share with everyone, but if not, I'll make sure if she shares with me that I will share with the board. As far as a start date, she did ask what my thoughts were. I did not give her a specific date. At this point, it has been a while this process has been going on. I gave Michelle, and I acted unilaterally. I hope the board is acceptable with that, to have a little bit of leeway with the candidate to allow them to give adequate notice to their current community, and an opportunity if needed to, take care of any personal matters between position changes. So I would anticipate, if it's accepted, this week, that we would probably see a start date within 4 weeks, but it could be as short as 2 or 3. It might be 5, but I did let Michelle know that, that a little bit of flexibility was perfectly acceptable. I'll speak from my side. I'd rather have them take a long weekend before starting here, but come in fresh and ready to go, rather than packing up office on Friday night and showing up here on Monday morning trying to hit the ground running. Take a breath is okay. So we're a health department. Self-care is important as well. We have the FY25 budget piece. Am I kind of on base with the will of the board of kind of that FY25 is really going to be that vision piece of administrative support, nursing support. I certainly don't see us building out nursing, administration, an agent, and a director in basically one budget year. I think that's probably a little bit impractical from a financial side, but again, not my decision to make. But I think that's probably going to be kind of what our next priority is as we start to make that transition from Neshoba. Anybody else have any thoughts about that process, their vision for how we look forward and start building that budget line? Seeing none. That gets us to the end. Board member updates, comments for discussion, and public input. So let's start with board member updates. We'll go alphabetical. Kevin Davis, any board member updates?
I have none. Thank you.
Gino Fratelloni?
He just walked away again.
Okay, thank you for sharing that, Brenda. Matt Waston, any board member updates?
The only piece I remembered about infectious diseases was I was going to say that strep is still out there. So while we are tailing down on our respiratory illness season, there are still strep cases going all over the place. So if you are falling ill or a child is falling ill, it's been atypical this year. So even if it's something like an earache, you might want to go be seen by your healthcare provider and get a strep test, just so you know what it might be and get on the proper course of antibiotics when necessary and prudent. That is all.
All right, thank you, sir. I have some questions to bring before the board that actually tonight was the perfect setup for things that have been kind of cooking in the background. I think we've noticed a bit of a trend for a while now. And that is kind of an operational piece. And tonight we had 2 cases where we had kind of last minute additions where we really didn't have an adequate opportunity to review materials before being expected to make a regulatory decision. And it happens on a regular basis. I mean, sometimes things come up that, something changes in the last minute, it happens, but it feels like we've gotten it a lot. And I'm not sure if it's just my perception or not. But I'm not sure if we want to necessarily explore as a board having some cutoff. If it's not in hand of board members at the 48-hour mark for the open meeting, kind of use the open meeting 48-hour timeline as a reasonable standard. If we don't have the pertinent materials for a public hearing at that 48 hour, pre 48-hour mark, can we administratively continue a hearing almost? That being put on I'm feeling, and I'm not sure if it's accurate or if it's just perception, that we have hearings put on basically as placeholders. And then today was the example. We had a legal document come to the office. What was it? It came to the office at 4:37, basically after town hall business hours, and it came to the board 11 minutes before we started. That's could we probably have figured out that document here? Yeah, we probably could have, but that's not necessarily best practice. This is not, certainly an emergent action comes before us, then yes, we're going to figure it out. If it takes us 3 hours sitting here talking about an emergency meeting and an emergency action, then we're going to do that. But for what should have been relatively routine matter, I guess I have some concerns with a pattern of last minute. Plans were turned in this afternoon. Our packet today didn't come to us until, I don't remember what time it came to us, 6:20 something or 5. I forget what the exact time was. I apologize, but it was later this afternoon. I tell you, the packet came out, I believe, at 4:00 this afternoon. Now, unfortunately, I was working, so I actually didn't see today's packet until relatively late. With changes in the plan, I'm not sure if we want to make any action tonight, but as kind of a mindset, do we want to set all pertinent materials need to be in place and in board members' hands, or the hearing will be administratively held? I just don't, how late is too late to get in? And I think it's 6:21 tonight is kind of, or 6:50, 6:49 when it came to us, is a little bit late for that timeline. I'm just not sure what the thoughts are of the board.
So, go ahead, Matt. You raised your hand.
I'll add the other perspective, which is this is a public meeting, and if we don't feel prepared and our meeting doesn't run smoothly, then anybody trying to watch our meeting or pay attention has to drag along with that, and also doesn't necessarily have time to review something. If somebody cares about an issue that is on our agenda, and that agenda has to be posted by a certain date and time, but they can't find out more details about that until the afternoon before the meeting, I think that's a disservice to the community members as well. So I agree with what you're saying. I would like things a little more buttoned up and tighter. And I agree. I think sometimes things get on the agenda because we say 2 weeks ago, okay, you'll be on the next one. And then it's hard to kind of bird dog that all the way. And I know having an external health agent adds a degree of complexity because it's another person to get involved and it has to go from A to B to C to D. And I get that. But at the same time, I think everything could be more efficient if we were better prepared with that. So I would also support setting some sort of expectation. And frankly, I would feel like when the agenda is posted, it should have the materials already. Because if you don't have the materials before the agenda is posted, then right there, you shouldn't be allowed to be on the agenda then. Because it just opens the door for some discussion, as it were, where we spin our wheels. So I hear where you're coming from. It's kind of also why I mentioned many months ago about having variance requests more specifically stated. And I know we started to include the whole packet of application that goes to Jim in those, and that's overkill for me because I don't read all those. No way. But I would love it if it just came back to, like we've seen, sometimes when we get those letters, it's a clear, concise letter that outlines the variances requested, and I don't have to go dig on a drawing for them. And it just makes it nice and easy and clear and concise. So it's in the same line of how can we make sure we are well prepared to make educated decisions that impact our community.
I agree, Matt. I like to try to be proactive when people send me things. So that's partly my fault. But on the other hand, I say, listen, that agenda is posted. Ted walked in today with his documents. 6:21, I received the the email from attorney Emily Langless, I'm sorry if that's not how you pronounce her name. And, so that's when I sent that email to you when I logged on. But I definitely agree. If that agenda is up on Monday and I usually send a draft agenda a week prior. I don't get any feedback. I assume if I get no feedback from this board and Jim, then that's what's going to print on, to post on Monday. I don't always have the material, so that's not the case. Monday, I did have to reach out to Attorney Gibbons' office and say, hey, are you going to be on the meeting? You're scheduled to be on the meeting. And then I got an email bounce back that she was out of the office. So I called the office, and then I'm not sure if it was the admin did say to me they both had it on their calendar. So that's how I confirmed. But then 6:21 is when I received this information today. So technically, it's before the 48-hour, and I would like to see a cutoff as well, because I do have other work to do and I'm trying to scramble around. And I stayed at work till 5:30 tonight trying to put these updates on, and left for dinner and came back for 6:30. So that's my time as well. And I agree. You want to be prepared. I knew that you probably didn't see it, but because I like to make everybody happy, I put it in the packet. But I agree, there should be some type of cutoff. And if they miss it, then they miss it. And as you said, Matt, if it's that important to them, they would have that material there. They would be prepared.
And to clarify, this is not a fault situation. This is simply, we have
Discussion.
no defined expectations, no defined process, and so
Right.
we wing it.
Yeah.
And so I think if we had a process and expectations, then people would be able to follow. And I think everybody would be
Right.
happy. We wouldn't have the last minute urgent.
Exactly. Yeah. Sounds good. Thank you.
And it's also thank you, Brenda, for bringing that up and reminding us that it's not a fair ask. Certainly that, for any group that has potential emergency action responsibility, that sometimes things happen after hours, or things happen, very, very quickly because we need to. But, it's not fair for, our municipal employee to be working overtime or answering emails at 6 o'clock at night and it's not a fair ask for as a routine piece. I'm not saying it is routine, but we've seen it multiple times, I think, in the last 6 months, give or take, that it's a big ask for our professional staff as well, to try to respond things after hours and last minute. It's no one's best work. No one's best work happens that way, us included. So again, I want to make sure that we are setting reasonable expectations for our residents, for our petitioners, but also that we're setting reasonable protections for our staff, who need to be able to manage this and try to do their best work and respond in a timely manner when there really isn't time to do that. And for us to be able to be prepared and make the best actions and make the best decisions we can with, the skill set we have.
So my comment to that is that we should set some sort of guideline that it's 48 hours at a time. And Brenda, you calling the attorneys to make sure that that they were aware of that, that's above and beyond, right? Like they're responsible individuals. They know when they were supposed to be coming to the board. I really appreciate you reaching out, but that's above and beyond. I really do believe that.
Yeah, no, it's definitely appreciated. I don't necessarily think a quick reminder going, it's Friday, you're on the agenda for Wednesday. We don't have your materials. We need them, or you'll be removed from the agenda before it's posted, isn't unreasonable. But I also don't want to add that extra workload for Brenda or anyone else who's kind of handling that piece. I have not talked to other boards here in town if they have any kind of a criteria. I think that might be interesting. This might be a great opportunity for us to leverage our new relationship with our town administrator to see if there's a consistent process. Because my guess is we're not the only board who has things non-emergently come up at the last minute. And is there a set of expectations? I'm not positive. I can't imagine that the select board would be crazy about having someone walk in at 11 minutes before the meeting and go, oh, by the way, here's all that information you need to take some action short of emergencies. maybe I'm wrong. Maybe I'm overreading this, but perhaps that's something we can work with town administrator's office to see if there is a standard or just how boards manage some of those pieces for consistency across all boards. I do have a hand up in the audience, Mr. Doucette. From when it went up, I'm assuming it is regarding this discussion. So I'm going to let him come forward rather than wait for the end for public input. Oh, never mind. He's already moved. There we go. Mr. Doucette, you had your hand up, sir.
Yeah, I can give you some insight from the other side of the table. So, we have clients that we're trying to serve as well as we can. And, there's some tricks of the trade. And I'm not here to say that, your problem is imagined or not something that you should be able to address and control. And the fact that Brenda has to track people down, that's not something that she should be responsible for. But the health agents have 45 days to review plans, and we have people who are trying to get houses sold and putting pressure on us for certain reasons. So peeling the curtain back a little bit and revealing my hand, one of the things that I do is I request to get on the agenda as soon as possible, because then Jim needs to, most of the time, he needs to review the plan before the meeting. Now, it shoots me in the foot and it shoots you guys in the foot, because then he doesn't, he tries to get it ready for the hearing. He gets it 2 days before the hearing. Then I have 1 day to get the plans in. So then I'm rushing in, 4 hours before a hearing or 2 hours before a hearing, dropping plans off. So, I think one way to resolve that situation would be say, septic plans, you can't get on the agenda until Jim has the review and maybe the approval, or at least the revised plans head back to him or something like that. But on the other side of the coin, there would hopefully be some expectation that you're not serving me who's out here designing, you're serving your clients. So if there's a way to say, look, we want our health agent to get the plans back, whatever you deem reasonable, 2 weeks, 4 weeks, something like that we get a review back to them. And then, I'm not playing this trick of, trying to get Jim's, review sooner and then shoot myself in the foot, because, everything would have been fine today. It could have been fine, right? In my hearing, you could have said, okay, we'll approve the variances. If I had all the variances on the plan, you could have approved them all and then just gone to the whole thing that I was trying to do, is go back to Jim for the plan review, and things like that. So I think that, yes, obviously it's an issue. Does it get caused by people trying to trick things or trying to get things moved along in a certain way? Yes. But then you also have a duty to your ultimate clients of the homeowner. So, I don't want to, Jim's good. He gets most plan reviews 3 to 4 weeks. That's not too bad given what he does. Some plans are, 44 days. So that's, somewhere in there between the 2 and 44 days would be something that'd be nice for us to get back to. So, that's the other side of the coin, and maybe playing games a little bit.
No, I will speak for myself that certainly we appreciate hearing that, because we don't see that side. So if that is this is why we need our neighbors and our residents and our friends to bring things forward, going, I'm a petitioner of town. The average homeowner hopefully will only ever have to do a Title V process a few times in their lifetime in a community. But certainly for our engineers who we see on a regular basis, if you're seeing a pattern, whether it's with Jim or whether it's with us or whether it's an admin or some other barrier to success, both for yourself as a business owner and for our residents, our neighbors, who we are all working trying to support, that, bring that information forward is really meaningful to us, to me. I apologize for the us for the board, but on my behalf as a member, it's important to bring forward, because if we don't know that one of the challenges that's creating challenges for us, and then therefore for the petitioners and the residents, is that you're not getting things back. You're getting things back in a timely manner on paper. You've met, the requirement is being met, but it's creating additional challenges. Maybe there are things we can change, maybe we can't. It's going to depend on workload. But if there are opportunities to try to identify those and streamline them, or come up with a process to minimize the impact for everyone involved, both the agent, for you, for the petitioner, the homeowner, and for us, so we can all be successful and move things in a timely manner, so everyone's as satisfied as possible is important. So I appreciate you bringing this back to us, because hearing from the engineer side that some of this challenge is created because simply you're trying to balance two things. You're trying to balance getting on the agenda in a timely manner. Okay, well, 45 days out from then, and then what's the next one after that? It's a bit of a game that, and I don't mean that in a bad way, but how do you make that as timely as possible while doing the job and using timelines in place? Every once in a while, that timeline doesn't work out. So I think we just kind of have had a pattern in the last few meetings anyway, or last couple months anyway, where it's come up a few times. And tonight we had two. That just creates a challenge that isn't fair for us as a board trying to do our job that we were elected to do. You as a representative of a homeowner who's trying to do your job, for the homeowner who now, doesn't necessarily have an answer that would hopefully they have by now. It's challenging for everyone. So this is really helpful. I know, it doesn't make you feel any better, but it's heard and it's appreciated, because we don't have
no, it
that view
does.
of it. We don't have that view of it until someone shares it with us. Like anything else, Mike, I've done a lot of things in my life, but one of my favorite phrases is, we can't fix it if we don't know it's broken. So if we don't know there are challenges out there, if that information is never shared with us, then we can't try to make things better. So that you and other engineers are sitting out there going, oh, here we go again. I'm not going to get this, when we never knew that there was a problem creating a challenge. So Matt Wason.
Yeah, Ted, thanks for your comments. I'm definitely looking forward to a future where we have better analytics as well, so that we as a board, whoever it is someday, can actually know how well we are doing performing some of these things. I mean, yeah, so the piece of paper says 45 days, but come on, I don't think there's anybody that wants it to be 45 days. Nobody tries to make it 45 days. I hope. So I would love a future where we can be looking at things and going like, oh gosh, we've slipped from 8 days to 14 days. We need to resource this differently or something like that. But that's a ways down the road. But just curiously, Ted, question for you. What percentage of your projects come to us?
Littleton is, let's see. I'm only doing what, 1 or 2, maybe 3 here a year.
Okay.
And I'm doing 35 or 40 a year, so it's a small percentage, but look I'm a resident. I've been on both sides of the table. I see how it works. I know how other towns work. I know how other boards work, other committees. Like, I think conservation, you have to have any revised information. They say, hey, it's got to be in here like a week before or whatever, 2 days before. That's not unreasonable, to say it. It's also, but then, again, like I said, if I have a predictable thing, if I know I'm getting that plan back in 3 weeks, I can tell the homeowner, look, we're going to get back in 3 weeks. Then we got the hearing on this one. It should be all squared away because I'll have the comments back and we're going to get away on one hearing. And, here's the day that you're ready to, get it out to contractors. So it's all just, working together.
No, thank you for that. We really, like I said, I brought this forward because it puts us in a bad place. It puts everybody in a challenging position that we want to avoid if we can. Sometimes you can't avoid the stuff, but if the stuff we can fix process or clarify process, I'm all in favor of that, because it makes everybody happier. If you know what you expect, it's a lot easier to deal with challenges than if you're never quite sure.
And I look bad when I'm walking into there at 4:15 with a set of plans, so, that's it. All right.
Yeah, that's great. No, I think we're all on the same page of how do we come up with a process that's just a little bit smoother for everybody, and hopefully can address everybody's needs, challenges, timelines, and satisfaction. Kevin, Gino, any other pieces around that discussion? I think, actually, Ted actually just shared a little bit going that, conservation has a 48-hour or 1 week requirement. I will reach out to town administrator office and see if they have a sense of what norm is, what the different boards, or if we can maybe reach out to the chairs and see or the admins for a what is their expectation, so we can try to be consistent, so everybody in town knows. Yes, Brenda, go ahead.
Mr. Chair, we do, especially if there is an abutter notification, they have to have at least 2 weeks. So I think most engineers know that. And once someone sends me an email or calls me, or Jim says, hey, get 16 Cedar Street on the agenda, that goes on right away. And I think, Ted, if I'm not mistaken, you and I had a correspondence on the 31st, And then on the February 1st, I sent out, could you please also send me your correspondence to add to the Board of Health meeting packet? So that was 13 days ago that I sent that email out. I don't know all the ins and outs because I'm still learning and new to boards and these type of situations. What happens then once I'm notified? But I notified the engineers right away. I tell them the time that they're on, the date that they're on, and I also send out the Zoom credentials to them as soon as I get them. Now, give or take 1 or 2 days with the Zoom credentials, but as soon as I know, I reach out to them and I ask them for their information right away so we can put that in the meeting packet. So this wasn't a last minute notice. So I just maybe don't know the process of everything.
No, please, Brenda, this is not you. This is not any.
No, I'm just saying, the process of how I work and how I do things.
Yep.
And even though the board's not always notified, as soon as I know, I reach out to the engineer, to let them know. So I just don't know on the back end, I guess, what happened. So, I could be missing things, but, we try to let them know as soon as they contact us. When I say we, I mean me.
I was gonna say you're a one-person office down there sometimes. I know. So no, this is not a criticism of you or what you're doing at all. This is really just this is a bigger process piece of how do we just make sure that everyone knows what the expectation is. It sounds like you are doing above and beyond follow-up. It's just make sure that we can, from Jim and the Neshoba folks, from our new agent perspective, and hopefully having that person come in once they get their feet under them, helping to build some expectations that are consistently shared. Again, not from you, but just mean in general, if here's kind of the process and having it in-house, because it's hard when Jim is 5 towns away doing other things. So, and is trying to balance a bunch of things. So
yeah, it'd be helpful.
So I think that was kind of what brought it forward. This isn't a criticism of anyone. This is really just it puts all of us in a challenging position, and it ends up that no one is happy with the outcome. We're not happy saying, we're not comfortable with this yet because we've just gotten it. The petitioners, the community, no one's happy with this, and there are ways that we can at least fix process and make sure that we can make things go as smoothly as possible when they can go smoothly. Kevin or Gino, any other pieces, thoughts? I think our next steps is figuring out what our norms are across town and across different boards and commissions, certainly the regulatory boards and commissions, because that's really the ones that are most peer to us for this matter. And we'll bring it back and see if we want to try to institute some process between the board, the new agent, Brenda, and just set up some kind of administrative SOP for timelines and pieces. So I just want to make sure it wasn't just me kind of seeing this going, is there a way of doing this better? So, but I think we're all on board going, there's probably gaps here that we could address. Any other board member input, comments, discussions? I have one last thing, but if nobody, I'll let everybody else go first. It's nothing big. Nothing. The only other one piece I have is for the board, and if anybody else has any more information for the community who may be out there listening, that the challenges with Steward Healthcare in Massachusetts are ongoing. That me as an individual member of the board, and I don't believe the board in general has any additional information beyond what is being shared from DPH and the news and the newspapers, that they are continuing their financial challenges. Obviously, that one of their facilities is Neshoba Valley Medical Center over in Air, which is for a big hunk of town, our nearest healthcare institution. So we don't have any additional information. Again, it's ongoing between DPH, Steward. DPH currently has DPH monitors in most of the 7 Steward facilities, and are anticipating having a monitor in all 7. And I'm not sure where Neshoba is on that list, but by the end of this week, supporting or monitoring staffing levels, equipment availability, some of those pieces, so that it is being monitored, and they are working with, from the Steward side, their partners and financial challenges, and DPH is providing oversight and information, but we don't have any additional information beyond what's publicly available as far as what happens. We are in a challenging position. We don't have a healthcare facility, a hospital here in town. We do have the bonus of, we do have obviously Neshoba, next door in Air. We have Emerson Hospital in Concord, not too far away. And we have Lowell General not too far away. And then, larger facilities beyond that. So certainly Neshoba has a potential to impact our community, depending if there's levels of services change. But we will, obviously, if we learn more, we'll share with everyone else. And if anyone has information, we're always happy to hear, because having a hospital change its level of service, either more services or less, impacts our community. So I'm not sure if anybody else has any additional information or thoughts, or again, the best of our knowledge right now is what's publicly available with the action plan. So, all right. Any other matters before the board? Mr. Doucette is still in the audience. His hand is not up, so I don't believe I'm going to take that no hand up, as he has no public input pieces at the moment. If we have no other discussion from the board.
Jano just removed himself. He said he's not feeling good. He had to leave.
Thank you for letting us know, Brenda. Before I entertain a motion, I am going to take an opportunity that certainly it's easy when we're in person meetings. Virtual is sometimes hard. That if someone needs to step out and we're in the middle of a discussion, that is perfectly okay. Just raise your hand, speak up, saying, "Hey, can we take a 5-minute recess?" That for my time as chair, I would rather have us take a 2 or 3 or a 5-minute recess, so someone can handle, a bio break or something, and be able to have us be actively engaged in our conversations, rather than having us, not be able to function as a board and as a team. So
Okay,
I
I'll
can
do
certainly
that.
speak
Thank
up.
you.
So have someone needs to step away. If you still want to be actively engaged in the discussion, just say, "Hey, can we take 5 minutes?" I'm personally okay with that, because I would rather see that than have someone miss the opportunity to provide meaningful input.
Can we just pre-plan bio breaks and sell advertising time?
Only if we get national media level percentages. I'm sure
We
LCTV.
have a department to fund, so
I'm sure LCTV would love to manage, 30-second blocks of advertising at national rates.
Just have a little banner running across the bottom, we'll be all set.
So just a thought, but I will bring it forward that obviously I'm not going to make anybody bounce or hold it if they need to. Obviously all of us will bop off camera sometimes. We just need a drink of water or cough or something. That's easy. We're still here to actively engage, but sometimes you just need to step away from the camera, and it's certainly also okay to say, "Can we take 3 minutes?" And that's perfectly fine. So thank you for drinking water. See, this is good. Hydrate, hydrate, hydrate. If we have no further discussion point, it is late. It's 9 o'clock. I will entertain a motion.
Entertain a motion. I make a motion to adjourn.
Second.
I have a motion, a second. Roll call vote. Kevin Davis.
Kevin Davis, yes.
All right. Gino Fratelloni has stepped away. Matt Wason.
Matt Wason, yes.
And the chair votes yes. The February 14th, 2024 Littleton Board of Health meeting is now in adjournment. Thank you everyone for your assistance and help. Brenda, thank you for staying late and all your work on this.